Hello everyone. According to various studies, the average person generates about 128 grams of waste every single day. This might seem like a small amount, but let's break it down further. When we scale that up to the global population of approximately 8 billion people, the total amount of waste produced daily can reach a staggering 1 million tons. Yes, that's 1 million tons of waste generated every single day. To put this into perspective, imagine if we lined up 1-ton trucks, one after another, carrying this waste. The line of trucks would stretch across the globe, endlessly, an overwhelming sight that highlights the immense scale of the waste issue we face globally. This number emphasizes just how much waste is being created around the world every minute of every day, and it's a challenge we can't ignore. Interestingly, much of this waste is not immediately visible to the human eye. We don't see giant piles of garbage accumulating at every street corner or in our homes, and that's because a significant portion of it is handled in a way that keeps it out of sight. But how does that happen? What makes this invisible waste possible? The answer lies in one of the greatest inventions in human history, the toilet. This humble yet revolutionary device, which many of us take for granted, has changed the way we live and manage waste. It's hard to overstate the importance of toilets in shaping the modern world. Their invention and the subsequent development of complex waste disposal systems have revolutionized human society, making it cleaner, safer, and more sustainable. Without these advancements, the world we live in today would be drastically different. The clean, hygienic environments we now enjoy would be a distant dream, and we would likely be grappling with constant outbreaks of disease. But how did we arrive at this point? How did we go from unsanitary living conditions to modern-day toilets and sanitation systems? The journey is long and full of fascinating developments. In the early days of civilization, waste management was practically non-existent. In fact, early humans had no proper means of disposing of waste. People would defecate in public spaces, in open fields, or near rivers, essentially wherever it was convenient. In cities, this problem was even worse, as the growing population meant that waste accumulation in public spaces and homes became increasingly hazardous. Without sanitation systems, disease outbreaks became a frequent and deadly occurrence. Cholera, dysentery, and typhoid fever would spread like wildfire, claiming countless lives. These ancient practices may have seemed normal at the time, but they were far from ideal. The lack of proper sanitation caused severe health problems, as waste would often contaminate drinking water sources, creating a perfect breeding ground for bacteria and viruses. As societies grew and urbanized, these unsanitary conditions became a pressing issue. Disease outbreaks, especially in crowded cities, were a constant threat to public health. The need for a solution became urgent, and it was only a matter of time before human ingenuity would begin to address the problem. One of the first recorded efforts to deal with waste comes from ancient civilizations. In ancient Mesopotamia, around 4,000 years ago, the Sumerians and Babylonians developed early methods of waste disposal. Archaeologists have uncovered evidence of clay pipes used to carry away wastewater and divert rainwater. While these systems were rudimentary, they represented a step forward in sanitation. Similarly, in ancient Egypt, some of the first known toilets were discovered in the ruins of the ancient city of Akhetaten, built around 3,400 years ago. These toilets were essentially pits with a stone seat and a drainage system, which was a significant leap compared to the open-air practices that preceded them. Despite these early innovations, it wasn't until the rise of the Roman Empire that public toilets began to become more common. The Romans were pioneers in many fields, and sanitation was no exception. They built complex public bathhouses and latrines, where people could relieve themselves while also socializing. The Roman bathhouses were often equipped with running water, which would carry waste away into the city's vast sewer system. The Romans were also responsible for constructing the Cloaca Maxima, a massive sewage system that helped drain the streets of Rome and prevent waste from accumulating in public spaces. This system, one of the oldest of its kind, still functions today. Roman sanitation practices were so advanced that they continued to influence public health systems for centuries. However, after the fall of the Roman Empire, many of these sanitation systems fell into disrepair, and the hygiene standards of medieval Europe deteriorated. During the Middle Ages, waste management was largely neglected, and public health suffered as a result. Without adequate sewage systems, people were forced to live in unsanitary conditions, often disposing of waste in the streets or in rivers. This contributed to numerous outbreaks of disease, including the infamous Black Death, which decimated the European population. It wasn't until the 16th and 17th centuries that there was a renewed focus on sanitation. In response to the growing urbanization of European cities and the persistent threat of disease, governments began to invest in public sanitation infrastructure. This period also saw the emergence of early plumbing systems, as people began to develop ways of bringing clean water into homes and carrying waste away. However, it wasn't until the 19th century, during the Industrial Revolution, that significant improvements in sanitation and waste management occurred. The rapid expansion of cities during the Industrial Revolution created a public health crisis. Populations in urban areas swelled, and the lack of adequate sanitation led to widespread outbreaks of cholera and other waterborne diseases. The connection between poor sanitation and the spread of disease was starting to become clearer, thanks to the work of scientists like John Snow, who famously traced the source of a cholera outbreak in London to a contaminated water pump. This discovery marked a turning point in public health and sanitation practices, as it highlighted the importance of clean water and proper waste disposal. It was during this time that the modern toilet began to take shape. Thomas Crapper, an English plumber, is often credited with popularizing the flush toilet in the late 19th century. While he did not invent the flush toilet, the concept had been around for centuries. His design and improvements to the flushing mechanism made the toilet more efficient and accessible to the public. By the early 20th century, flush toilets had become increasingly common in households, and public sanitation systems had improved dramatically. The development of modern sewage systems was also a crucial part of the sanitation revolution. Cities began to build extensive networks of pipes that carried both clean water and wastewater. These systems ensured that waste was removed from populated areas quickly and safely, reducing the risk of disease outbreaks. By the mid-20th century, most developed countries had established comprehensive sanitation infrastructure, and public health improved as a result. Today, toilets are an essential part of daily life, and sanitation is considered a basic human right. According to the World Health Organization, WHO, more than 4.5 billion people around the world now have access to improved sanitation facilities. However, this access is not universal, and millions of people in developing countries still lack access to proper toilets and sanitation systems. The lack of sanitation in rural and impoverished areas continues to contribute to health problems, including the spread of waterborne diseases. Global initiatives are underway to address these challenges and improve sanitation access for everyone. Organizations such as the WHO, UNICEF, and various non-governmental organizations are working tirelessly to ensure that every person on Earth has access to safe and clean sanitation. These efforts are not just about building toilets, they are about improving public health, reducing disease, and promoting dignity and equality for all people. In conclusion, the story of the toilet is a testament to human ingenuity and our ability to solve complex problems. From the earliest attempts at waste disposal to the modern flush toilet, the journey of sanitation has been long and full of innovations that have saved countless lives. The invention of the toilet has had an immeasurable impact on public health, and it continues to be one of the most important inventions in human history. As we move forward, it is crucial that we continue to invest in sanitation infrastructure and work toward ensuring that everyone has access to clean, safe toilets. By doing so, we can create a healthier, more sustainable future for generations to come.